Hello, my name's Colette and I'm really looking forward to talking with you today about validation and empathy. Before I start though, I would like to acknowledge the Palawa and the Ngunnawal peoples of Lutruwita, Tasmania, where I'm working from and doing this presentation from today. I do acknowledge that the land was never ceded, and I do pay respect to the elders past, present and emerging. So, what are we going to be doing today? Let's have a look. We're going to look at empathy and validation, maybe take you through the background to that and some tips, and I will go through some objectives in a moment. But first of all, I really want to thank you for inviting me to talk to you. I think the program that you are on as mentors or supporters is absolutely amazing, and Quendo has done a great job in setting that up, because there's nothing like having a supporter and a mentor who already has empathy, because you understand a lot of what's going on. So you may or may not pick up some of the tips there, but you'll also know what you're doing well. If you're doing something really good, and it's always sort of feels good, some models are there that you can look at and go, I am going through that, and I do notice that. So we'll look at some models, we'll look at some skills, and hopefully we can add to the program and the outcomes of the program that you are involved in. So linking with your program, first of all, I've looked at that and tried to relate the outcomes to that. Your program at Quendo is trying to create a connection so that your person also feels supported, and that you explore things with that person, and that they feel empowered. So that's the kind of philosophy of the Quendo mentor program, and connection and support, being supported and exploring things and feeling empowered is key to what I'm talking about today. So I think we're aligned, and I really hope that that you'll find at the end of this that these are some of the things you'll get. So you will understand, perhaps the aim is to know a little bit more deeply about empathy and compassion, and look at the differences between sympathy, empathy and compassion, and then and the importance of those things. Why is it important? Why do people ask for that? Why do they need it? And then we'll look at maybe applying some of those skills in various ways, and then we'll be looking at developing and cultivating that response. What responses can we use? Very often you can say, look, just be more compassionate, will you? Yeah, but how do I? What do I say? So I always feel it's good to know some options about what you can say in a situation, and practice it, and you get good at it. And if it's also coming from a genuine place, it really does work. And in that, you're going to create a supportive environment, and obviously by the end of that, we hopefully that you'll look at some self-evaluation and how you're doing, and be able to do some assessment on your program that you're doing. So that's what we're going to be covering today. They're the outcomes. I suppose if you have any questions about those, you can talk to your leaders there. So I suppose first we do need to look at the definitions of sympathy, empathy and compassion, see if we can find any differences, and I think you'll probably know yourself what these things feel like when you've been on the end of them. So just think about that really, and what you're doing, because it helps you to then understand what it's like if you use those things on someone else. So basically, sympathy is feeling sorrow or pity for the hardships that another person encounters. That's genuine, isn't it? It's good. You feel sorry for someone. The only issue I think you'll understand there yourselves is you don't want pity, do you? Because it's like that other person is above you. They're outside of your experience and they're feeling sorry for you. So that's a slight little nuance there. Then if we come to empathy, empathy was actually built on sympathy. It came in the 1900s, and it's actively sharing in the person's emotional experience. Here is the definition: understanding, being aware of, sensitive to, and vicariously experiencing the feelings, thoughts, and that experience of another. And I think as mentors and supporters, as I understand it, who've been through pain and difficulties and everything else, you can actually say, I'm on that level there. I'm on a level. I'm feeling with you. And it came from a German term which is feeling into, or let's have a look, feeling into or feeling in. So you actually have that emotion with that person, and that's a leveler, isn't it, as you all know yourself. So that's a little bit step up from sympathy, and that's the difference there. Then if we come to compassion, look when that was in the dictionary, 1300. So compassion is there. It's a consciousness of others' distress together with a sort of motivation in there to alleviate that suffering. You want to go over and get in and get involved. You're not only feeling that sort of pain, you want to do something about it. And so that's the sort of idea of compassion. Now, you may not always do the right thing, but it's that motivation to do something for that person. And, you know, there is now more use of this word in the medical field. Empathy is still in there because patients and people talk about that. Compassion is a kind of an ethical sort of look at how clinicians might use it. So we'll talk about that later. So clinical communication is a prominent component of compassion in healthcare, and that's sort of the latest thinking around that. So there are the three, and I found also that in the Compassionate Mind Australia website, they've actually said a sensitivity to suffering in self and others with a commitment to try to alleviate and prevent it. You can see how things sort of develop and change from that definition. They've taken that definition and they've sort of used the word commitment. So this is another indication of how we as human beings adapt and use different meanings in different situations. So be aware of that. But I'm hoping at the end of this, you now feel a little bit clearer about how sympathy for me here is the odd one out, in a sense. It's still genuine, but it doesn't have that equality to it. And then you've got empathy and compassion, which does. And compassion has that added element of wanting to do something about it. However, it doesn't mean that if you're empathetic, you may also want to do something about it. So those two are more intertwined. Okay, so let's look at Brené Brown. If you haven't seen her, she does a lot on the sort of psychological elements of this, and she feels that empathy is thought to drive connection and sympathy is thought to drive disconnection. And so, excuse me, I think that basically we can see how when someone feels sorry for you, it kind of puts you off a little bit. And when someone is leaning in and they're empathetic and they're there with you on that journey, you're actually building a connection. So empathy is a word that comes up a lot in patient surveys, people who have been dismissed, people who feel that people just don't get it and don't understand. And so we did our own little survey, but it builds on, I mean, Victoria had a survey about chronic pain. There's so much now, as you well know, about endometriosis, adenomyosis, etc., and persistent pelvic pain, and how that impacts on people's lives, and also trying to find empathy and someone to validate that pain. So we thought we'd try and validate that ourselves, and we asked 20 of our people to volunteer if they wanted to fill in a questionnaire. So I thought I'd share this with you because I think this leads into why we need to address it as people. And so I don't know if you can guess, but we asked them to say what they felt was really important, and it was when they see a general practitioner. And it you know, I suppose it could be other people, but we talked about going to their GP. And then we also said what is most important in that ranking. So here's what you said you wanted, and here's a list of the top 10, 20. We want you to rank them, which isn't easy, but it was perfectly, absolutely clear what they wanted. So I don't know if you can guess now what was number one from those women. Yeah, okay. Empathy. You're right. Empathy, not sympathy, and not compassion. Empathy. So they know that word, they use that word, and they really want someone to be on that journey, to listen with them, to have. I don't know if we can exclude people who haven't experienced persistent pelvic pain, but it would add some credibility to it, I'm sure. But you don't necessarily have to have lived through that to have empathy, because you have lived through some other pain. If you live through loss, if you live through a pain of some other kind. So that was number one. Now, I don't know what you think number two was. What do you think was start thinking about the top five, maybe. The top five. Yeah, so empathy was number one. And then we were shocked about this too. But from the GP, yeah, you're empathetic. You really are there with them. But are you up to date with the latest research? So basically, you want your people who are dealing with you to know what to do, to know where to go. And it would be ideal if they did, because it's number two. So this was very helpful to us when we looked at GP training, because even we were surprised that was up there. We thought maybe, number 6 or 7. What's the point of being empathetic if you don't know what to do next and you've never heard of it? But, if you say, I'm really sorry, I've not heard of it, I'm going to actually look at that, I want to invite you back, that's all fine. But, let's get up to date with the latest research. Then following that, to be curious and interested in what is going on with me. So please ask me questions, be interested, because I think all of that leads in to, that leads into empathy. You're curious, you're asking questions, and you're genuinely interested. That is going to help. So they're the top 3. And if we look at the next row, these are 4th, 5th and 6th, equal. These were in equal place. So you've still got your women's health experience in there. Look, women's health, extra training. Please know a little bit about women's bodies, women's pelvic health, and etc. Here, look at this. This is for you as well. Very, very key. Listening skills. listening skills are underestimated in my view. It is a skill, and if this can be done well, you're going to build connections, you are showing empathy, and there's so much in that little word, those couple of little words there. And look, I was looking for validation. I thought it'd probably be empathy and validation second, but it wasn't. It's down there though in the high end, number 4, validate my experience. And I don't think I need to talk to you about that because you're going to get that. But we wanted to sort of perhaps use that to show GPs how important validation is. And there is evidence around validation in health. So we've also included that in any training that we might do. So they're the top ones. I'm just going to show you the others because you'll probably want to know out of interest what they are, and I'll just put them up, then you can have a look at them. Yeah, so there they are in a kind of an order there. You've got the rest, you've got the whole person in there. It's so important, that bit. And I don't know what you think of the others. Maybe you're probably reliable, does what they say they're going to do. These are all things that are actually trustworthy. I think, personally, I think they all feed into empathy, validation and curiosity. So that was our survey. It compares, and I'm just going to show you now a graph where you can actually see it ranked. And we did rank the answers as well, so it was all done scientifically in that respect. So empathy is well ahead, and then you've got the others. So if we're trying to look at understanding why it's important because that's what people feel that they need, that they're missing, that is going to help them move forward. You know, so that's why. So let's move on a little bit to why is it number 1? Why is it number 1? This is probably a bit complex. Maybe you can tell me why it's number 1, why you think it's number 1. But it is. And I think that we look at research very quickly, because I'm not going to go into details on this one, but there is very little research on women. Most research has been done on men's bodies, on men's reactions to drugs, and we know there's a distinct lack of research on women. Endometriosis is a very good example of that. We're late, very late coming to the party. And I suppose when I look at all the research, there doesn't seem to be any other reason than sexism and discrimination, in a sense, that's embedded in society. And that's why it is now been given a special kind of area in women's health. It's a population health issue for GPs. It's something that really does need looking into more carefully. It's like cultural awareness and culturally safe practice. It's key to understand what's gone on before. What went on before? Why are people reacting like this? And that is why. It's basically in there, and it takes a long time. So I think with persistent pelvic pain as well, as you will be aware, it's private, it's very personal, and you know, it's a part of your body that there's a lot of things going on. There could be trauma, that you don't want to talk about things. There's so much has to be there to create a safe environment, and there's different cultures as well that adds another layer to that. So you know, empathy is a great start. It's number one in, before you do anything else, you're actually building that relationship. So, yeah, self-awareness, acknowledgement of bias, knowing there could be frustration, mistrust, lack of energy, fear, sense of helplessness, shame is a big one, and having compassion and genuine care. So that is in there, and I think that if you look at a couple of these quotes here and this one here, for medical practitioners, which you are not, possibly some of you are, but if you're not, then this is still relevant in a sense. I feel that change is possible, change is coming. It takes a long time. It takes 5 to 10 years in an organisation to change culture. So it takes a long time, but it can be done. It's been done in other areas, and it needs to be applied to endometriosis, adenomyosis, etc. If I say persistent pelvic pain in this program, it's because I cover all those in that term, so I'll probably use that. So social norms, discrimination, etc. And I think even as females, I'm part of that system, you're part of that system. It's almost like we've got to be aware ourselves of our own bias in that system. We've been brought up in that system. You know, oh, I better not go forward and say that because, you know, I'm a bit shy, or oh, I can't, you know, raise that with anybody. You know, we are part of it. So it's good to understand and be self-aware, I think, in that situation. I don't know what you think about that. I don't know if you can, I mean, for me, someone told me this and I'm like, well, that sums it up for me, really. And that is, do you know when the female clitoris was first mapped in the anatomy of women to use in, you know, medical texts? What year was that part of our body mapped? Well, it was mapped by a female doctor, Dr. Helen McDonnell, and it was 2005. Now, I know that's 20 years ago, but 2005. So it was never in any books. It was never known about the whole mapping of the clitoris. You know, just used to be perceived as the very top part and not the rest that's underneath. And if you haven't seen it, you better go and look it up now so you know what it actually looks like, because it's incredible that that wasn't mapped. And that to me sums up this whole thing. So as a model of care then, and I suppose I put this model in for you because I think, clinical or not, this probably does help you as supporters and mentors, because it's a model of care. You're caring, you're listening, you're being empathetic. And so empathy is got this breakdown. Now this is one model. It's not, it doesn't mean it's correct or anything, but I think empathy is a dynamic process, and it's a two-way thing. It's reciprocal in a relationship. It's, you know, there's these features in there, and I like it that they've broken down the features of a model of care using empathy. So you've got that connection, you've got curiosity, you've got that perspective. You're trying to get another perspective. As a mentor, you've got your own lived experiences, imagining what it's like and seeing it from their perspective, but also you've still got your own perspective. It may be different. So being aware of that, and then, you know, the mentee is an individual in that sense and needs to be treated with dignity. oh, I felt this, I felt that, oh, I understand, I know what you're doing. But you could be overriding that own individual's experience, lived experience of what's going on. And then care. You're acting appropriately on the understanding gained to help the mentee. So what you may think is the right action or what worked for you may not often be the right thing for that person. So you've got to act appropriately with your action. And that's an interesting one because you're doing it as a pair. You can discuss it, what would work, what wouldn't work, what you're comfortable with. So always keeping that open communication going. This is what somebody said, look, listen, understand, take me seriously. Verbally express hope. I need hope. And understand how much IBS affects my daily life. Now that is from a study on IBS that we'll look at in a moment because it's a microcosm of what we're talking about. IBS is just, another word for other elements that could be going on. But the study was about IBS. And I love it that it says there about communication skills can be learned and practiced and can increase patient satisfaction and therefore mentee satisfaction too, because you're learning about how to communicate and listen, and they will feel a lot happier by the end of that. And you would if you were, maybe you have been on the other end of it, you kind of know what works and what doesn't. Okay, so one of the issues I think that's important to note here is that there's some new thinking about compassion. We talked at the beginning, empathy's got its models, it's very useful, it has different types, and it's what clients want, it's what people ask for. But in a clinical kind of setting, and maybe for you too, just not understanding the difference here and how it's changed is that you can burn out from being empathetic. And they're calling it now empathetic distress fatigue, as you can see, or it used to be called compassion fatigue. But now they're saying compassion is one way you don't burn out because you're also showing love to yourself. You're compassionate to yourself. Self-care, self-love. I need to take care of myself. I'm listening. I really feel what you're going through. However, I'm just helping you by stepping back a little bit so I can help you more, really. I'm looking after myself. I'm not getting really pulled down into too much of it so that I can help you. And I think that's a new understanding of compassion. So I quite like that. I like that. I don't know what you think of that. But I've been in situations myself where I'm really passionate about things. I get so passionate that, I want to change the world. I want to change it. I want to make things different. And you can burn out from that kind of passion unless you recognise what's going on in your body, unless you recognise that that's really not going to help anyone. If I'm ill for a month, that isn't going to help anybody. If I can avoid it, then I probably should think about that. And I also think that being objective can help people. And if you're really involved in someone's issues and trauma and problems, it can affect your ability, I suppose, your ability to listen and see the patterns and what's happening there. I mean, you're not a psychologist, I understand, but you are a person, and that humanity there can help you to understand that you're human too. And so I think that's worth remembering when you're a mentor and a support worker. You can't fix everything. You're not there to fix everything. And it doesn't affect your passion and your empathy to have some self-preservation and self-compassion. So just to summarise, I mean, we actually have talked about the differences and the definitions of sympathy, empathy, compassion. We've even gone as far as to look at compassion for yourself and how compassion as a model now is being used so you don't burn out. So you can be passionate and empathetic, but look after yourself at the same time. And also we've looked at a model of care. You know, actually there is a model that's been used in healthcare that breaks down that empathy as a model of care. And I've talked about that too. And I think underneath all of it for me is really communication. And there are some models, simple models, that I want to share with you. There's a couple here that I've pulled out that you may or may not find useful. You might think, no, I don't agree with that model, Colette. Or you'll say, oh, that's interesting because that's what I do, but there's the model, I can see it now. So have a look at these, because communication is key, and there's a lot to it in a sense, and I want you to have a look here. So one of the first ones is one that I'm pretty sure you will have heard of. It's called the iceberg model. It's usually used in systems thinking, and there's 4 levels to it, but we're not going to use that today. We're just going to look at this as a sort of principle model. And so they look at it. I mean, no, it's not that. That's the sea. That's the sea, okay. And then we have, I've mentioned it, an iceberg, and there is the tip of the iceberg at the top there. And then underneath that, you've got the rest of the iceberg. And whether you know it or not, or you remember, I don't know if you know that 1/7 of that iceberg is at the top and the rest is underneath. So at the top, what's showing is only 1/7 of it, and underneath is there. I showed it to you, and I did that in pink. And I think I wanted to show you that when you ask someone a question, perhaps I should give you an example, like, hi Colette, how are you? Yeah, I'm fine. Or so how did you get on yesterday, Colette, with that meeting? Yeah, it went really well, actually. Yeah, it went well. You know what, Colette, it didn't go well, did it? I can see it didn't go well. You said it went well, but it's not what you mean. And when people say I'm fine, if you look a bit deeper, they're probably not fine that day or that moment. Very often we're in a hurry and we're like, oh great, how are you today? Yeah, I'm really well. Bye-bye. So there it is. If I, at work, for example, I might say to ask the receptionist, could you, look, we need to book that next week. We need to get that person in. If you can, that'd be great. And then if you can book them 3 other appointments close together, blah, blah, blah. And they're like, yep, sure. You okay with that? Yep, that's fine. You go. And they're like, I don't know. Oh, God, what am I going to do? What'd she say? What was that? Oh, God, I don't want to ask her because she's so busy. I've asked one simple question, maybe even. Can you do an Excel sheet? And underneath, you will see whether the person knows how to do an Excel sheet or whether they're really frightened, whether they don't understand what you've just said. It could be that they don't understand the words you've used, the language you've used. So they might even say, yes, I understand. Underneath, they are shaking. They are got all these emotions. This is where the emotions are underneath here. Underneath here are the emotions, the feelings, thoughts, and up here is what you might hear or see at first. So that's the iceberg theory. And then this theory, don't know what you think about that one, but this theory is my favourite, to be honest with you. It's, again, there was research done on this, and it's when you're communicating a message from one person to another. So it's not on the phone, but we can see how it impacts on that. It's not when you're on the phone, but it's usually face to face, and you're trying to get a message across from one person to the other, and then maybe them back to you. But it's just a breakdown, and I want you to think about it. So in a message like that, we have tone of voice. We've got tone of voice in a message, and we have the words in a message, and we have the body language in a message. So the three elements are there, you know, talking about things, you've got your tone of voice, you've got your body language. And if you had to break those down to equal 100%, can you break that down for me? Just guess. You know, just guess. Break those three things down into how important they are in communicating a message. So I'll give you a little minute to think about that. Maybe jot it down. So I don't know, because I'm here, what you've thought about that or what you've written down. But did we get to 100%? Now, I'm not very good at maths, but and you probably rounded it off like you can do. So you probably said 40% or whatever. But tone of voice is 38%. And I think that's, you know, over a third-ish. And it's over a third. And you might want to think about that. You've probably got people in your lives or at school or somewhere that have a tone of voice when you know that you're in trouble. You know things are good and going well. You know, it's the tone of the voice. So that is 38%. Now, we've got words and body language left. So I don't know which one you thought was next highest. But let's look at the words. So the words in getting a message across, 7%. So I've just wasted my time talking to you because you're probably not listening, and also you won't remember. That's the other thing. You won't remember unless I do vary my voice, change my tone of voice. I've got much more chance of you listening to me. That's the point, I suppose, here. And if you see, you know, sometimes someone will be with a child at a party, a child's party, you know, and they've got to go, or they're at the park, or even partner to partner, and you're like chatting to your friend. Yeah, I know. And then what she's, and then she did this. Jonathan, we're going in a minute. I said we're going. Okay, get your things. And then, and so I know, and then she said this, Jonathan, we're going. Come on now, we've got to go. And anyway, so there you are. Unless you're going to face, Jonathan, we're going now. You go over, you face, you got the tone of voice right, you're not carrying on your conversation, you're not showing that you're going, you're not really meaning that you're going. So really, the words don't mean very much, do they, at that point? I could also say, I'm really confident. I'm really confident about this, doing this session, and I'm so confident about doing it, and I can do it. Sorry, you can't hear me. So what am I saying? I could even say, I am not a confident person. I really can't get up in front of people and do a presentation. I just can't. You know, the words don't mean as much as what else is going on. And I'm hoping, here's the hint. Here's the hint here, because 55% is your body language. That is how important body language is in a communication, and it goes for what you're trying to do too. Because also you can therefore reverse this, and you can pick up hints from this, and you can pick up messages yourself from how someone else's tone of voice is and how someone else is trying to say words, but really the other two things are far outweighing that. And you're going to try and read a bit more into that. They're giving you clues. So this changed my life actually, and I was learning to be a trainer at the time, and one of my colleagues was teaching this model, and I'm like, that is so powerful. It's mainly, of course, I had to do presentations. And if you've ever been to a presentation and someone has a tone of voice, yeah, they have, but if their tone of voice is monotone and it's the same tone the whole time, and they're talking for an hour and a half at the same tone, it's not great, is it? It's not really that great. So and some people, don't forget, this is a general thing, it's a model, and there are times when we have to forgive all the things, because some people, they're unable to maybe use their body for body language, or their words, or their tone of voice. So don't take it for every single person and every single situation. But if you take that in general and you want to get a message across, that's the model there. So how are you doing? I think that now we've got a couple of models and we've talked about definitions. I think you're probably ready to have a think about this in terms of, we've looked at the language and the body language model and the words, and we've looked at the iceberg model, and if again we've got what's going on underneath for you guys as well. You know, there are beliefs and values and judgments and fears all going on for your mentees and for you, and it's about acknowledging that and recognizing that we have got them, they're there, so to acknowledge them and be aware of them is a great step in being able to empathize with someone else. You know, I understand this must be really difficult for you. You know, I might not agree with it, but you can do it because you genuinely feel empathy for that person. So what you're going to do is, from these two models, I'd like you to pick up 2 areas of communication you'd like to work on in the next couple of months. And you can, you know, you could write down my tone of voice, my body language. I'm going to think about that a bit more to support the things I say. I'm going to make sure I notice this more in people on a day-to-day basis, or at home or wherever. And also you might want to look at the iceberg theory and take that as a model. And so I'm really going to work on trying to pick up what's going on underneath, and not always trust the top bit, the bit that's sticking out. So I think if you pick 2 areas and then you score them now as to how you're doing out of 10 or whatever, you could then come back and see how you've done. That's an option for you. You can pause here and do that now. So that's a little activity that I'd quite like you to do. So just before we look at this definition a bit more closely, I want to reassure you that the great thing about empathy from research and studies is that it can be learned. It has nuances to it, like, you know, logical, emotional, analytical elements that can be learned, and the body language and all of that can be learned. There are skills in there. If you think about sympathy, it's like it comes automatically. You feel sorry for someone. And compassion, is also, could be automatic, that you're so compassionate and you've got this human feeling, you want to reach out and you want to help someone. And the difference with empathy is it can be learned. And so I really love that. And I'm just saying it in here that there was one study, just reading this little bit out. It's relational, it's a relational communication. Linear communication is A to B, but there's still stuff that does go on underneath, of course, that we talked about. But in relational stuff that you're doing, it's stated in one study that through relational communication, actively listening, involve listening to the subtext of what is not said. Being attuned to the non-verbal clues, using silence, and paying attention to tone of voice can help uncover patients in this situation, concealed suffering. Concealed. They're not opening up. They don't want to talk about it. But you can see that they are giving you signs. And so it gives you a clue to just probe a little bit more, to ask an open question. So it's really, really important. And then I also love that it does focus on developing skills in empathy, and caring involves some degree of identifying a person as a human being. That's the key in compassion. They're human. The whole person care. I don't know if you remember that from the beginning, but you know, you're involved, you care, it's genuine. And finally, just on that part of empathy, is that, as I said, it can be learned. Empathy, this is a quote from this study, unlike compassion or sympathy, is not something that just happens to us. It's a choice to make, to pay attention, to extend ourselves. It requires an effort. That is a bit harsh, isn't it? That we have to learn it and it requires an effort. But goodness, it is so worthwhile to learn it and to do it and to pick out those nuances that can help you do it. And that is why I really do love empathy. So look at this. Now, this is what you're doing. Respectful connections, you're building it. And you can read that for yourself. But I love that too. The warm tone of voice, respectful management of time. You know, that is an action right there. Informed consent, same for you. You know, what shall we do? Would you like me to raise that for you? You know, just all of that. This is in a slightly different context. And I think you've obviously probably talked about confidentiality and open communication. And the different one there as well is repairing ruptures. So it's quite hard, as you know, if you had a bit of a thing with someone the week before and you sort of don't talk about it, it can be quite difficult to then move forward or back on track. So I love it when people say, look, I'm really sorry about last week, that I was late, or I'm very sorry that I sort of misunderstood you just then. I sort of overreacted, or I shouldn't have said that, or you just apologise, and you can repair that really quickly with an apology, a genuine apology. Sorry about that. Well, you know, we've seen kids do that. No. So if you want to repair something, just talk about it and admit it and move forward, because that person, and I know you will appreciate it when it's been done for you. So that's a thought that I've raised there about relational ruptures. You may have one. So think about it. How are you going to deal with that? So let's talk about validation. We've been through what empathy is and some tips about how to actually do that. Validation is similar, but there are actually terms and things you can say that help to validate somebody's pain, someone's experience. And I think the key for you probably is because you are special. You've been in that situation, and you have empathy. And I think that validating is something that you appreciate. If you've had it yourself, you'll know what it feels like. When you tell a story, you tell about your pain. You've had people who have validated that pain. They've believed you. And then there are people who haven't. And what that creates as well, because it can create more pain. And likewise, if you validate, it actually, in evidence, can reduce pain and make you feel better. Just having that and having a plan of action, someone who believes you, can reduce pain. So it's really important. I think probably the only thing for you, like me, is to remember to do it, because you might take it for granted. And in a mentor-mentee situation, just keep doing it every now and again. You know, like don't just do it at the beginning. You know, do it. And here are some tips and phrases you can use, or you can adapt them. Now, I don't know if you're in pairs or you can be in pairs. You can do it as a pair. But if you're not, you just listen, read these comments, have a go at them, and I suggest you record them actually into your phone if you want to practice them, and you can hear them back, and remembering it has to be genuine. And I know you're genuine because you're there as a volunteer. You're caring for someone else in that role. And I think that validation is something that you could use to create that environment of understanding and continuing to do that. So this was from an IBS study, so I've just put it down literally as it is. And you can change IBS, can't you? You could change that for endometriosis, persistent pain, pelvic pain, adenomyosis, or just, what you have. It must be really difficult for you. So that's one. And I'm going to put these down now, and I think that I want you to say them, not me. So let's have a go. So hopefully you'll pause the presentation, you'll have a go at these, and you'll get better at it. And if you do it already, do more, and it's brilliant. And these are from a study, so you can read these, you can use some of them, and you might find some of them helpful. I won't go through them. It's giving hope, it's understanding, validating, and I think that you're not a clinician. However, there are things you can do with that person to help them through on their journey, and I think that knowing they know that it's real, that you've been through it, and you can help them through it is key. So there are some useful tips in there you might want to use. So we've looked at validation, and there's some actions there, and we've covered a lot of them in communication. And I just want to hone in on a couple here to give you a couple of extra tools if you don't already know them. Some of you may do that. But I think that mirroring is quite powerful, and you can look into that more, but really it's trying to pick up how that person is feeling when you first see them. And now you may be on the phone, you've lost body language as an element of being able to read how they're feeling. So you're going to have to listen to the tone of voice more and the words. So you've got less clues. But if you're mirroring and you've met people who are totally oblivious to how you're feeling, and they go, "Hi, how you doing? I haven't seen you for ages. How's it going?" They didn't even see you approach. They didn't see how you felt. And I think mirroring is, you might tone that down a bit. Hi, how you doing? Are you okay? You know, it's sort of coming down and meeting that person where they're at. That's what mirroring actually is. And it's a good place, it's a good level to go to build up, because that person feels that you're kind of in tune with them. The other thing I think that's important is open-ended questions. So if you have someone who is really shy, who is quiet, who may take some time to really get to discuss the things that are important to them, open questions are great. And I have this little tip. It's a little rhyme that helps me to remember. Now, you might not remember the rhyme, but it's I've changed it a little bit for you, but it says, "I have 7 serving mentors. They taught me all they knew. Their names are what, when, why, and where, and how, and which, and who." So as long as who rhymes with new, it works. It doesn't matter about all the different things, but there are 7 open questions. And if you just remember that, you'll know that they're all about what, how are you feeling, what happened then, where did you go after that, why was that so difficult, do you think? That must have been difficult, yes. Did you go to the surgery or not? No. So they're closed questions, and they're going to close someone down. And I think you'll know that, but opening up a conversation is using those 7 questions. So that's them. And you may need to summarise in what you do. You may need to paraphrase someone, because you can hear someone say something, especially on the phone, and they might be telling you something, and you might have to go and talk to someone else. So you say, "Look, just so I understand, you felt like this, you said this, and then that happened." And they go, "Yes. Well, actually, at the end it was like this. So this, and this." So you're actually summarising and paraphrasing. And that's a really useful tool if you've got to go and do something or write a goal, or, you know, so there's that too. So, validation, you can do it at the beginning. Now, this is, in terms of medical people, is so important to do this at the outset of a consult and to get in there early. And I think probably in your mentoring role, it's important that you do it too. And just because you've been through it doesn't mean that they feel validated with their own story. So I think it's really powerful that you can do that. And that is that what it is BAC, B-A-C. And I like to remember it by, I've got your back, but it's B-A-C. And that is that you've got belief, you've got acceptability, and you're communicating the belief and acceptability of the individual experiencing the pain. And I think we know now that that can reduce stresses associated with the pain, and not being validated can increase the stresses. I really think that you won't be in that situation. But to remember to validate because of this, you know, I believe you, your pain is real, and I'm accepting that it's real, and I'm communicating to you that belief and acceptability by validating your pain. So that is important to know, and that is from a study. And finally, you know, in that therapeutic alliance, I don't know if a mentor-mentee is a therapeutic alliance, but actually, thinking about it, it probably is therapeutic and meaningful and healing. You'll have to look that up. You'll have to find out what you actually think about that. But it's an intervention that helps compliance to treatment plans in a clinical setting. And I don't know if you knew that, but if your doctor or your GP or whoever validates your pain, understands and actually expresses those things that we've been talking about, then after that, if they say, look, I suggest you go and see so-and-so, they'll help you with this. I suggest you take these for a month. You know, you're more likely, patients are more likely to comply. And I don't think you've got anything that your mentees need to comply with. But I think that they will more likely join you on that journey and you join them on that journey together. So that's my feeling about that. So in communicating a message, we've looked at certain models, but there's a lot of noise that goes on underneath the iceberg, so to speak. There's things you can pick up with your skills and listening skills, etc., body language, but there's noise in the sense of our values, our beliefs, our attitudes, our judgments, all coming from the past, all coming from our current day. And so be aware of that noise, and then you can overcome it to really get to the heart of communicating well with somebody and being empathetic and understanding, even better than you are now. So don't be afraid to be quiet. Don't be afraid to observe and listen. And don't be afraid to ask open questions to help someone move along. If they don't want to answer, you can find that out, that you'll find that out from body language or tone of voice. So summarising, you've really got your active listening, you've got your body language, you've got your open questions, you can summarise things, and you can repeat some main points. If you end a session and you have to go over the main key points or goals, you can do that. And that really helps move the thing forward as well. So we've come to the end. And I really hope that some of the outcomes have been met. I hope in a way that some of them haven't, due to the fact I want you to be questioning and thinking and asking, I wonder, could I use that model? I don't agree with that model. I know all this stuff. Why do I need to know more? I don't know. Just that you are in a really good place as a volunteer. You've been through a lot of these things, and I wish I was there with you to actually meet you and hear some of what you've been through, because this is going to make you a really good person in terms of being empathetic to your mentee. And I believe that you're definitely advanced in this field. So I do hope, though, that you've got a better understanding of empathy and compassion, and that you can apply some of those skills and try them out. Also, that you can cultivate a compassionate response by you've learnt some techniques and acknowledging and validating stuff. So I think that will help, and therefore you're creating a supportive environment by using all of those skills and picking up certain elements of it. Measuring effectiveness can be done by yourself. You know, set yourself some goals, as we talked about earlier, Also practicing some skills, getting a pair with somebody and practice the open questions. And if you can get in a pair with somebody, I think it'd be great to try out some of the skills that you've learned here and the models that you've learned here. So I wish you all the best, and if you do want to contact me, I'm very open to questions, and my email and contact details will be on the screen. Thank you.